Yes, I think increasingly we're recognizing that at heart of general anxiety, from the cognitive point of view, is that the person wants to control everything in their lives. And if they can't control everything in their lives, they regard themselves as failures. And of course, the more we live in this world of rating, which is what we're living in at the moment, where everything has to be done perfectly and everybody feels all the time that they're being constantly judged and constantly rated, control becomes increasingly important. So for the person with general anxieties, they want not just 100% control over everything, but almost 110% control over everything. And because this is an impossibility in real life, they become very anxious. And if they can't achieve this control, they start to rate themselves as failures. So in many ways, general anxiety, in terms of their cognitive, in terms of their thinking, is actually very simple. The whole approach of the book is to show people how to challenge this part of ourselves when it's overactive like this. Social anxiety is actually a state of an incredible anxiety that a person is going to feel when they know that they're going to have, for example, to meet a group of people in a pub, or where they're going to have to perform a particular task in front of people. So there are two kinds of social anxiety. One is called social interaction anxiety, and the other is called social performance anxiety. Can you imagine that if you were going to meet 2 or 3 of your friends down in the pub this evening? Now, most of you would just be getting ready and heading off. But think of the world of the person with social anxiety, because I'm going to describe it for you. They're going to start and they're going to spend maybe an hour either in front of the mirror, checking every solitary thing about themselves, checking to see is their facial, do they come across as confident, is their appearance all right, and then maybe in their own minds rehearsing every solitary thing that they're going to say during the time that they meet the people in the pub. Now, some people, they'll be more anxious meeting strangers, and other people will be more anxious meeting one-to-one people. They're now on their way down to the pub, they head to the pub, they arrive there, and the first thing they'll do is one of two things. They'll either go straight to the bar to get a drink to calm down their anxiety, or they'll go straight to the toilet to check the mirror once again to see, how am I coming across? And believe it or not, some people will be so worried, for example, that people will see that they're blushing, that they'll be checking the mirror. Others will, for example, will be very concerned that people will see they're sweating, and they'll be wearing a jacket, even though it's very warm inside, in case somebody would see that they were sweating. Many people, for example, will stay at the edge of crowds. They'll stay close to the exit. They won't start conversations. They're terrified of being brought into a conversation because they're afraid that people will think that they're going to say something stupid or something that's totally inappropriate. And a typical thing, before they go to speak, they'll be rehearsing in their own minds what they're actually going to say. And then when that's all over, they'll go home and they'll spend an hour doing a post-mortem. How did I do? How did I come across? What did people think of me? Did anybody notice me sweating? Did anybody notice me blushing? Did anybody notice me anxious? And that's the world they live in. And of course, their natural instinct is to avoid such situations, but if they have to do them, then they'll carry out all these safety behaviours, like staying at the edge of the crowds and all the rest. The second group of people are what we call social performance anxiety or performance anxiety. And the classic example is the person who may not, strangely enough, get anxious in interaction situations, but is now asked to give a talk at work, a presentation, or is asked to get up and maybe make a speech at a wedding, or is actually asked to get up and give a talk to a group for some other reason. And they're now losing it. They're completely freaking it, okay? And of course they will spend, again, hours preparing and over-preparing and over-preparing and over-preparing to make sure that they cannot make a mistake. And that's their big dread, that when they get up, they're somehow going to make a mistake. So those are the two main kinds of anxiety, main kinds of social anxiety. Well, we now know that particularly in the social interaction type of anxiety, that there's an area of the brain called the amygdala, which is in charge of our stress system. But one of its jobs is to scan faces looking for danger. So what we find that in social anxiety, it's actually slightly overactive. and it's misreading the signs. So it's actually seeing in people's faces danger signals that are actually not there at all. And the second thing that it does, because it's in charge of our stress system, if it gets irritable, it fires. So we get all these physical symptoms. So the person heading into a social situation will feel themselves, tummy in knots, shaking, sweating, heart going quicker, maybe mouth dry, all the physical symptoms of acute anxiety. So the amygdala is firing in those situations, and the closer they get to the social interaction, the worse it begins to get. So that's what's happening very much in our bodies. But in our brain, we have another part of the brain called the prefrontal cortex, which is catastrophizing about everything that's going to happen. So they have this visualization that they're going to make an absolute mess of the social situation, that people are going to end up laughing at them, judging them, thinking they're stupid. And of course, because they live in this world where they're gravitating between being anxious and being embarrassed, it's a nightmare for them, and social interactions become something they dread. And of course, all it takes is for somebody to say, well, actually there's a wedding coming up, or there's a birthday coming up, there's a party coming up, or there's a very important work due coming up. And of course, people get more and more and more anxious, try to avoid it if they can, but then if they have to go, then their whole world begins to cave in, and they have to go through all these different behaviours we talked about. What they're actually worried about is when they go into the social interaction situations, that people are going to see something about them that will make them assume that they're anxious. So that they're worried that people will think that they're an anxious person. The second thing that they're worried about is that people will think that they can't converse, because they in their own minds think they're boring. They think they have very poor social skills, they think that people will not be interested in listening to them, and they think they're going to mess up all their conversation. So they're so afraid that people will notice they're bad conversationists or very anxious. And of course, why are they bothered about these things? Because people will judge them. And that's the heart of social anxiety, that people will make some judgments about me, and I have to accept these judgments, and therefore I become ashamed or embarrassed. Well, what's going on in their heads, believe it or not, the commonest thing that they're worried about is they're going to get a blank. That at the heart is at the heart of social performance. So what they're worried about is they're going to get so anxious that in the middle of the talk, their mind is going to go blank. And when their mind goes blank, they feel they're going to be standing there looking stupid. And what will people think of them? And that's at the heart of it. So the more anxious they get, the more their mind is inclined to go blank, so the more likely it is to happen. So once again, they're anxious, and they're worried that people will see they're anxious. They're worried that people will then make judgments about them, and we're back to the same, almost the same thinking concepts as in social interaction anxiety. Really good news for all the people maybe who are listening to this video, that this is one of the simplest forms of, shall we say, anxiety that we can deal with. I can get rid of most people's social anxiety probably within 4 or 5 sessions. We see this over and over and over again in practice, that all we have to do is get the person to change the way they're looking at it and change some behaviours, and we can dramatically reduce their social anxiety. So I, for example, would have young people coming into me sometimes, and after 3 or 4 sessions they find their social anxiety almost non-existent. I'd like to make a particular plea here to young people, because people under the age of 25, one of the big concerns I have is because they're spending so much time in social media, they're beginning to create this virtual perfect identity on their social virtual world, but are completely losing the skills of one-to-one interactions and empathy and conversational skills. So I would really appeal to them to try to kind of veer away a little bit from the social media side of it and try and get involved more in everyday social interactions. But for people who are getting into this kind of difficulties, the good news for you is that CBT principles, as we lay them out in flagging anxiety and panic, are incredibly powerful at getting rid of this form of anxiety.